Having completed equipment preparation and calibration, it is time to meet your patient and prepare him or her for the spirometry testing. Introduce yourself as the patient enters the room. This will help put the patient at ease. Verify the patient's identity per your institution's procedural code. Next, briefly explain the test that you are about to perform to the patient and any family members who may be present. Also, encourage the patient to ask any questions he or she may have about the test and answer those questions in simple words and phrases, avoiding the use of technical terms and acronyms. Once you've introduced yourself and acquainted the patient with the spirometry test process, document various patient attributes: height, weight, age on day of testing, gender, and race. Record the patient's weight to the nearest pound or kilogram. Weight is generally not required for the predicted reference value, but documenting the patient's weight accurately is important nonetheless, especially during the interpretation of test results. Measure the patient's height to the nearest centimeter or 1/2 inch. He or she should be standing upright, in stocking or bare feet, looking straight ahead. Two additional aspects of the patient's height and how it factors into spirometry testing are: the taller an individual is, the larger lung volume he or she is expected to have, and an accurate height is required for the predicted reference value. If the patient cannot stand due to physical limitations, or if he or she has a marked spinal deformity, an alternative is to measure the arm span of the patient to estimate standing height. With the patient's arms straight out, even with the shoulders and palms forward, measure from fingertip to fingertip. Also, check your spirometry software, as many programs can estimate the patient's height when an arm span is given. Record the patient's age on the day testing is performed. Unlike weight, patient age is required for the predicted reference value. The patient's gender is also required for the predicted reference value. This is due in part to the general expectation that the average male is larger than the average female, and as such, has a larger lung volume than his female counterpart. Whenever possible, enter racial ethnicity, as the patient's race may impact the expected results and subsequent interpretation. Documenting the patient's clinical history is also a key component of the overall spirometry testing process, as it can assist in understanding the clinical question asked of the test. The patient's clinical history can also be useful when it is time to interpret test results. Examples of clinical history include shortness of breath, coughing, sputum production, wheezing, work history, recent illness, and so on. Be sure to include the patient's smoking history, the number of years smoked, the average number of packs smoked per day, and current smoking status. Having documented the patient's clinical history, the next step is to record all medications the patient takes that may impact results of the test. Examples include, but are not limited to, bronchodilators, anti-inflammatories, beta blockers, leukotriene modifiers, and anticholinergics. Record the medication, when the patient last took it, and the dose. This will aid the physician in interpreting the test results and assessing the impact of therapeutic interventions. It is common to request the patient to refrain from using short-acting bronchodilators for 4 to 6 hours prior to testing. When you have finished recording the patient's medication, interview the patient regarding pre-test instructions. Then, verify that the instructions for withholding or taking medications were followed. If pre-testing instructions were not followed, it is advisable to contact the ordering physician. Next, verify the clinical indication for testing and any possible contraindications. Key indications for spirometry testing are: diagnose, evaluate, and assess. Assess and monitor ongoing respiratory disease management. Evaluate for rehabilitation, insurance, legal, and research purposes. Most patients, pediatric and adult alike, can safely perform spirometry tests. Even so, because spirometry is physically demanding and requires maximal patient effort, there are contraindications of which the technologist should be aware. Patients with any of these conditions might not be able to perform tests safely, nor provide results that are acceptable and repeatable. A few, but not all, contraindications to be aware of. The presence of chest or abdominal pain, nausea, or diarrhea. History of a myocardial infarction within the past 1 month. Recent thoracic or abdominal surgery, or thoracic, abdominal, or cerebral aneurysms. Recent eye surgery. Inability to comprehend instructions, for example, dementia. The ATS, ERS, and AARC have published comprehensive lists to assist technologists in identifying indications and contraindications. It is important to have thorough knowledge and understanding of these indications and contraindications, and to carefully consider them when gathering patient information during the pre-test phase of spirometry testing. Introduce yourself to the patient and others accompanying him or her. Verify patient identity. Briefly explain the test to be performed and answer any questions the patient may have. Patient height, age, and gender are required for the predicted reference value. Record the patient's weight and racial ethnicity if possible. Document the patient's clinical history. Record the patient's medications, doses, and time last taken. Verify clinical indication for testing and any possible contraindications.